On behalf of the Area Agency on Aging of Pasco Pinellas, I welcome you to Aging on the Suncoast. The wish of most people is to stay at home as they age, even when more care is needed. Medicare has created a community-based program called PACE, providing care and services to older adults in the community who would otherwise need the level of care provided in a nursing home. PACE, or the Program for All-Inclusive Care for the Elderly, is available in Pinellas County through Suncoast PACE program, which is affiliated with Suncoast Hospice. On today's program, we will learn more about the PACE program. Joining us from Suncoast PACE are Stephanie Sessions, the Executive Director, and Bethany Latorno, the Recreation Director. Thank you both for joining us today. We're excited to learn about this program.
Thank you for having us.
Yes, thank you for having us.
Stephanie, tell us what the goal of the PACE program is.
Sure. As you said in your introduction, we actually want to provide services for people who want to stay in their home and age in place, but maybe need a little more support in the home. So we have many things to help keep them in their homes and in their community where they want to be, or maybe even with their families, so that they can stay in their home and age where they are.
And Bethany, who is going to be the likely participant in a PACE program? Who will benefit from this program?
Really, we have a wide range of participants. We have some that are living by themselves in their homes and just need some support and some social interaction. And we have some that are living with their caregivers, and their caregiver just needs a little respite so their loved ones come to the center. So we have a wide variety of participants, and we try to tailor activities for all ranges and ages.
Excellent. Stephanie, talk with me some about the eligibility for the program. Who would be eligible to participate in a PACE program?
The program, All-Inclusive Care for the Elderly, is a program for frail elders, and that means anyone 55 or older who has a need and meets the level of care that they might qualify for nursing home care. And it's generally covered by Medicaid, Medicaid and Medicare. When you do join our program, there are no copays for prescriptions. We're kind of unique in that we cover all of their medical needs and provide services for them that include a physician. We have a physician in a medical clinic right on site. We have a day center where people can come because, as you know, studies have shown people that are lonely and in their homes tend to have health issues as a result of that. So we bring them to the day center for socialization, for activities, which Bethany can speak to. But it is a great program, and it's, like it says, all-inclusive. So we even cover transportation, we provide meals in the center and sometimes meals in the home if needed, care in the home, care in the day center. So it's really very comprehensive program.
So once someone enters the Suncoast PACE program, all of the services that would normally be delivered through Medicare or Medicaid would come through this program.
That's correct.
But I'm hearing that you say in addition to that there are additional services such as the nutrition and the transportation.
Right.
So it really is, as I read the material, I was impressed with it being very comprehensive.
Yes.
That all-inclusive means all-inclusive. And it sounds like you are working based upon the needs of the individual, responding to those needs.
Yes, we actually have an interdisciplinary team. So we have a large group of people who work with the participants and their families to formulate a care plan so that we know what their needs are. We look at the services that we can provide, and we tailor that to each individual participant so that, and as their needs change, we get together and we may change their plan of care. So we work for, look for the things that they're going to need that we offer in our program. Not everybody may get everything in our program, but some people may get every single thing in our program because they need it. So it's tailored.
So actually their doctor visits will be through this program?
Their primary care physician would be our primary care physician. And we also have a nurse practitioner on site. We have the clinic open when the participants are there. So let's just say, they're having a bad day or something doesn't look right or they don't feel good. We can bring them back to the clinic. They don't have to leave our premises to go anywhere. And by the same token, if they're at home and they're not feeling well, we can send the transportation out to pick them up and bring them, or their family can bring them into the clinic and we can see them in the clinic. And we are quick to get them in because we want to act on something quickly and keep them as healthy as possible.
Sounds like there is a very important preventative component to the program, both in terms of providing proper nutrition, proper medications, but also this being aware of the daily well-being of the individual. And that oftentimes an ounce of prevention is worth a pound of cure, as they say. So, we've mentioned that the day center. Tell us, Bethany, what activities are offered at the day center?
We offer a variety of activities depending on their level and what is needed for that participant. We have some that are receiving physical therapy, and there's some things that we can do in the center to continue what therapy is working on. We also try to offer or try to encourage independence. We have one of our participants is actually teaching the other participants sign language, so we really try to get them involved in the planning. Each month I get together with the participants and we plan some activities that they would be interested in. We offer morning current events. We have some volunteers that come in and do a laughter yoga program. We have an art program. We have participants who are in their 90s and they're learning something new. We have Reiki volunteers that come in and help. It's a therapeutic touch that really helps some of our participants with arthritis and things like that. We do Wii sports. We have different trivia and cognitive programs. Go out on picnics, and we have a gardening program with a raised planter, which will be easier for them to work in the gardening. So we try to maximize their independence as much as we can.
It sounds like you were taking every opportunity to make it possible for people to continue to enjoy both things that they have enjoyed in the past as well as engage in new activities.
Absolutely.
How frequently do people come to the center?
The interdisciplinary team gets together when they first come on, and we develop what would be the best for each participant. We have some that come 5 days a week. We have some that come, typically it's 2 days for most of them, and we have some that just come in for monthly monitoring because they're very social in the community and have that support. So each participant is different and is decided upon.
And how long is the day at the center?
Typically they start coming in around 8 a.m., have breakfast with us from 8:30 to 9:30, and then at 9:30 we start our morning activities. We start with our current events, and we do an exercise program, and then about 2:30 we have a lunch at 12, and then 2:30 we do a snack, and then between 3 and 4 they start leaving for the day.
Okay, so it's quite a day's program.
It's a busy day, absolutely,
Yes.
and we really encourage involvement and participation in the activities throughout the day. So it's a very busy day for them.
And Stephanie, how many people do you have participating in this program now?
We have 161 participants for this month, and we can take up to 225 currently in our program. Okay. So we still have some openings.
So during the course of the program, our program today, we will run the telephone number and the website so that if anyone is interested for themselves or a loved one to learn more about the program or perhaps to ask about participation in the program, they can call and get that information from you. Talk with me we've talked about the socialization, and certainly, studies show the impact of depression and loneliness, and you are really combating that. Have you seen results from that within your participants?
Oh, absolutely. Yeah, absolutely.
Yes. When they come in for their initial tour, they're usually very quiet. And then once they start coming into the program, you just see them. They're talking more and engaging in programs, and it's really great to see that. And, to develop relationships with their peers is very beneficial. And we're more like a family there, and really just to see how they progress is amazing.
Do you typically have, if someone's coming in 2 days a week, they're likely to see other participants that come in the same 2 days a week so they can create those connections?
Yes.
That it's they're making friends they have something to look forward to during the week, that Tuesday is going to be the day that they get out and are able to participate in this. And tell me about your staff. Who is on board as staff each day at the center? Do you have a nurse and
We have, in the day center, we have our day center supervisors and LPN, and then I'm the recreational therapist, and then we have some program aides. So they're CNAs and they help with the activities throughout the day. And then we have on staff, we have our social workers and our RN case managers. We have an LPN home care coordinator. We also have a dietitian on staff and a dietary aide on staff. As Stephanie had mentioned, we have our medical director and our nurse practitioner, and we have some RNs that are in the clinic working. I'm trying to think.
Center manager.
Oh, center manager.
Who's an RN also, and myself, and I'm an RN as well. So lots of medical eyes on healthcare professionals.
And we also have our physical therapists and our occupational therapists.
So when you see a change, when one of the participants was there on Tuesday and Thursday, they come and you see that they're lethargic or that they're not as engaged, you can respond to that medically. You can do an assessment, and so it's really very prompt care that you are providing. You mentioned that some of your participants live alone, some live with families. What is the impact that you're seeing on the families that have loved ones in this program?
Yeah, I think, there is a group of people who, their children are still working. They maybe can't live completely by themselves, but their children wouldn't be able to work, or they would have to be placed if they did not have this program. And those are the ones Bethany, I think, talk about. They come 5 days a week while their children are continuing to work, and then they care for their family, their loved ones in the evening at home. So we provide that peace of mind for them, that they're getting activities, that they're getting fed, that someone is caring for them during the day while they're working.
How wonderful that when they sit down at the dinner table, Mom has something to contribute about her day, that she's been out and about with other people, that you're not the sole source of support for or entertainment or engagement, that she's able still to enjoy her own life and bring that back to the family to share. So everyone has something to contribute at the dinner table.
And we do hear those stories. We just had a meeting with a couple of the family members in our PAC meeting, and she was just saying that very thing, like it's so nice to know that I don't have to think all day of, I don't have to worry about her all day. We know she's taken care of, and she just loves it. She just loves it there. So,
we've mentioned the center several times. Where is it located?
We are in Pinellas Park. We're on 102nd Avenue North. Is it North? Yes. And we are right next door to the Pinellas Care Center.
Okay. So you are able to serve any Pinellas County resident that meets the eligibility criteria. Transportation is provided. Fortunately, you have a very central location, but you go from Tarpon Springs down to South St. Pete and out to the beaches. We don't have a PACE program in in Pasco County currently that I'm aware of, or in Tampa. That we're fortunate to have it in Pinellas County. Well, I applaud you for what you are doing. During our second segment, we're going to talk with another member of your staff, but we're very pleased that we will have one of the participants, and we've gotten a glimpse of what a day looks like at the center, but I'll be anxious to hear from him, to learn what it means to him to be part of the program. So I hope our viewers will join us after this short break.
Sarah is 64 and loves to garden, but recently her health insurance ran out, leaving her worried about more than just weeds. With pre-existing health conditions, Sarah's chances of finding good coverage were low. So she called the Elder Helpline and spoke with a Shine volunteer counselor. The Department of Elder Affairs Shine program provides free, unbiased counseling on health insurance for those on Medicare. More information is available about Shine or how you can volunteer at 1-800-963-5337.
During the first segment of today's program, we talked about the Program for All-Inclusive Care, or PACE. During this segment, I'm pleased to welcome Diane McWhorter, the Care Center Manager, and Stephen Cantrell, a participant in the Suncoast PACE program. Thank you for joining us.
Thank you for having us
today. We learned so much during the first segment, but Steve, talk with us some. You've been participating in this program.
Yeah.
How long have you been part of it?
4 months.
4 months. And
yes.
Do you go to the center each week?
I do. I go Monday, Wednesday, Friday.
Okay, so 3 days a week you are at the center.
Right.
Has this made a difference in your life to be part of this program?
Sure has. It's made things a whole lot better.
Yes.
They have a lot of activities. They get everyone involved, and they have just things where you can relax and be involved and do things. They have a very good medical clinic. Then they have their daycare where they do all the activities and stuff. And it's very nice. And also the big thing is they do have assistance with showers.
Ah, okay.
Now, it's something you don't usually think of, but believe me, it's good.
So when people come into the center, you're able to provide personal care for them in addition to the activities?
We do have shower facilities. Depending on what their plan of care outlines will determine whether or not they're appropriate for a shower or they need a shower. Because of safety issues in the home, the shower is not really a safe setup at home, so we could bring them in for showers as determined by the plan of care.
What are some of the other favorites of the activities that they have there?
Well, actually, they have a bank of about half a dozen computers, which is very nice. And they have the internet access, and they have games every day, which is good. And you make friends.
You have met people there that you enjoy?
Yep.
And look forward to seeing?
Yep, sure have.
That is wonderful. That is wonderful. So you find that people make friends?
They've made a lot of meaningful relationships, even once they leave the center and outside of the center. Sometimes they call each other to check on each other. It's really amazing to see the bonds that they form.
And Steve, how do you get to the center when you come on Monday, Wednesday, and Friday?
On the van. Now, Suncoast PACE provides a van also.
Okay.
So I go there in the morning and come back in the afternoon. It worked out great.
So transportation is part of it, and whether it is you were in a wheelchair, so you were able to provide wheelchair-assisted transportation?
Door-to-door service.
Okay. And you live in the home with your family?
Yes.
So you have some support at home, but yet now you have your own life.
Right.
You have a life outside of the home that you can bring back information about what you did for the day and new friends. And
sure do.
It's so important too. Sometimes they're not necessarily completely isolated at home because they have family, but it's not their peers, and for one reason or another, if it's, mobility, cognitive deficits, they're isolated from their peers, so they can, the day center is a place where they can come and be with, people on the same level.
So often I have seen men who are thirsting to have the company of other men. At home they're surrounded, by their wife, perhaps their daughters. They're just surrounded by women. And to go somewhere where they can be with some buddies is something to look forward to. So, and it sounds like you have a very diverse group of participants, but yet the care plan is for the individual. That the team that you have evaluates what the needs are of the individual, and then they set out a plan of care. Steve may be receiving personal care at the center. Someone else might not need that.
Exactly. Some people that don't necessarily come to the center, 3 days a week, may need services in the home. So that's just something. It's a partnership with the family. We want to keep the families as involved as possible, but it is a partnership. So we don't take over full care.
Right.
So that, we keep everyone engaged.
Well, and our studies show that caregivers can provide quality care for much longer when they have a support system in place. And certainly individuals living in the community can live in the community with the quality of life that they want when they have the support system. You mentioned that you do go into the home if that is what is needed, and you can provide home health care there? Or
If that is what is needed. We can provide home health aides for light housekeeping, for preparing snacks and for personal care as well.
And we touched on, I think in the beginning segments, something about therapies. Tell me more about what type of therapy you are able to offer.
We have a big therapy suite where they have machines and equipment that they can come in on their day center days, usually in correlation with their day center days. They can come in and get their workout and get their therapies and the modalities and continue the physical therapy through activities, as well as restorative. We have a restorative aide that works in the center. So she continues the occupational therapy or the physical therapy. We have a contract with speech therapy, so if they need a swallow study or we notice, that they're not tolerating meals, consistency of their meals and things like that, we can have the speech therapist come in during lunch and evaluate them.
So again, this goes back to you delivering all the services that a person would be able to access through Medicare or Medicaid, but then going far beyond that.
Exactly, outside the box.
They do.
How did you learn about PACE, Steve?
Word of mouth in church. And I heard about it, and lo and behold, here I am.
So, and it sounds like it was a good match for you.
Oh, yeah. Yeah, it does, very much.
We will be running, again, the telephone number and the website for Suncoast PACE so that if our viewers know of someone that would benefit from the program, they can call. As we discussed in the beginning segment, there is the potential of accepting new participants. It is not full at this time.
Correct.
So that is good news. Steve's story is certainly a success story. Are you seeing similar successes with participants?
Mostly the ones that were living alone and were isolated, again, because they can't get around in the community because of physical mobility. They've just lost the ability to go out in the community, and so they become isolated. And so really the ones that you don't think are going to adjust to the center because they've been isolated for so long, you just get them. Usually we talk them into coming under the guise of, well, you're coming for therapy 2 days a week. So kind of get them acclimated like that and then go from there, starting just to get them engaged in different activities that they thought they might not ever have been interested in. But like I said, in talking with their peers, they join in.
Can you share with us an example of someone who has benefited from the
One in
program?
particular, yes, that we can think of, and he was isolated due to severe rheumatoid arthritis. He attends the center 3 days a week. I think he might have a girlfriend that he looks forward to seeing 3 days a week, and we're able to provide showers at the center. And he's getting his meals, nutritional needs, some issues with nutrition that we're keeping an eye on as well. But when he comes in, we can monitor his intake and weigh him and things like that.
So often we see in the people who are in the community, perhaps they go into assisted living and they improve so dramatically because they are getting good nutrition, they're having their medications monitored. That can make such a difference, and you're providing this without the need to go into a residential facility
And
or
it's
the need to go into a nursing home.
And it's the subtle differences, and we really rely a lot on our staff on the floor, the CNAs, that see them every day, that get to look at them and you know, touch them every day and have their eyes on them every day. They're the ones that are going to notice the subtle differences, subtle changes, and it doesn't have to be, you know, a nursing assessment that does that. They can let me know, and we can triage it through the clinic. Sometimes it's nothing, and that's good. But sometimes it's the beginning of something worse. So.
Now, Steve, you're receiving all of your medical care now through Suncoast
yeah.
PACE. You have
Sure
a
do.
primary care physician there.
Yes, and they are top notch. They're really good.
That is good to hear. So you, if you're having a problem, you feel that you know you can
yeah.
contact someone right away. You're going to
Yep.
get prompt medical care.
That's right. All I do is I go and talk to Diana, and I'm in there in 5 minutes.
Oh my. So the medical clinic is open every day,
Yeah.
every weekday. And if people are at home and need medical care, is there a provision for that also?
We have nurse case managers that are also in the field. So if there would be a need, for some reason we can't bring them in right away, or they can't come, or they're refusing to come in right away, we can send an RN to their home to check on them and make the determination whether if it's serious enough, you know, they need to come in. She can talk them into bringing them in to see our physician.
Again, everything goes back to that part of the PACE acronym is all-inclusive. And you're finding, Steve, that it is all-inclusive, your medical
yeah.
care, your socialization, food. The food is pretty good?
Yeah, it does.
Okay. And it sounds like it starts with breakfast and a snack and lunch, so people are getting good nutrition while they are there.
Yep, they have the dietitian that their diets are also tailored to their needs. You know, we have specialty diets. We have pureed diets. You know, no added salt, no concentrated sweets. So it really is very personalized.
Wonderful. I thank both of you for joining us today so our viewers could get an understanding. This is a really, in our area, new and innovative concept. And Diana, I thank you and your team for the work that they do, and Stephen for being here to let our viewers know it's a concept that's working for you.
Fine.
And to our viewers, I thank you for joining us today. I hope this information has been of interest to you.
Sarah is 64 and loves to garden, but recently her health insurance ran out, leaving her worried about more than just weeds. With pre-existing health conditions, Sarah's chances of finding good coverage were low. So she called the Elder Helpline and spoke with a SHINE volunteer counselor. The Department of Elder Affairs SHINE program provides free, unbiased counseling on health insurance for those on Medicare. More information is available about SHINE or how you can volunteer at 1-800-963-5337. James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called SHINE. SHINE volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. SHINE costs nothing but could save you time and money. More information is available at 1-800-963-5337.
You're watching PCC TV, Pinellas County Connection Television, a division of Pinellas County Communications.